Taking care of a critically ill pediatric patient is extremely stressful, and adding in math homework in the middle of it, well, that's nearly impossible. That's why it's so important for us to use a cognitive offloading tool like the hand heavy bag, or there's a fly, or for my in-hospital friends, the Broslow cart. It takes some of that mental workload off of us so we can focus on the things that only our brains can do. So in comes the hand heavy app or the Broslow cart. My phone just locked up on me. So for us, we have an app on our phones where we just select what weight or age the patient is, and it tells us what the doses of medications are, what the sizes of equipment. And additionally, we have this bag that mirrors like the Broslow cart that you have in the hospital. And so it says the ages on here, right? Here's a 7 to 8-year-old. This is going to have the ET tube size that I need. It's going to have everything that I need if I need to manage this patient's airway, breaking it down by age. Additionally, I have all of my pediatric stuff here. I have an OB kit, my pediatric and my infant BVM, all kinds of things to take care of my pediatric patients so that I can focus on recognizing what pathology has caused my cardiac arrest or this critical illness and intervening appropriately. It makes it not so hard because you know what happens when we enter that fight or flight mode, that sympathetic surge that comes with pediatric cardiac arrest, no breathing, no pulse, and you're flying to get there and thinking, oh crap, what do I have to do? Well, this helps you. So when we are in that sympathetic surge, we tend to leave our prefrontal cortex. That is our decision-making headquarters. This is where cause and effect, this is where math is done, all those good decisions, and we tend to go down to our survival cortex, which is our midbrain. And you know what we do there? Our pulse, our blood pressure, our respiratory rate. So number one, do the mental work to keep yourself in the controlled thinking space of your prefrontal cortex. Don't let yourself go to that freakout mode, but then use the tools that you have, like your hand heavy bag, your Broslow cart, what have you, to provide really good care to those critically ill pediatric patients.